Genetics, vision, and development. When you're dealing with a child with genetics conditions, right, it can throw you off because you're looking for development and you're not thinking of the other things that can be happening. I'm very concerned for genetic conditions, but also for vision. Why am I concerning this? Hands up and that kind of non-purposeful play. He very good attention for auditory, right? But for visual, you know what I mean? I'm not, again, for a baby just to be there in the stroller and things like that and not getting that visual attention. I think we need to see where there is visually. Now, visually with genetics, it could be environmental, like back here, I'm busy, right? And like to say, oh, these are glasses, like, do you really see them kind of thing. It could be structural, meaning the eye itself needing glasses, let's say, or that there's something going on with the optic nerve, let's say, retina. And then there's also neurological processing. So some genetics do have low visual responses because the corpus callosum, let's say, hasn't formed properly. But you're not getting that I see it, I want it kind of, and that's what really all milestones are. It's not that they're rolling over. It's like there's something there that they want. Ooh, all of a sudden they're rolling over, or they're sitting up and they're going. You know, these progressions are taking in command. Sorry, because they see it, right? When the vision goes, then everything else goes up. Then there's heightened auditory, tactileness in the mouth, that kind of thing. But because there's directionality, my ears are hearing. You think vision is okay, but I'm concerned for visual vision because of just the lack of engagement. And also too, what do you do if it, like, let's say that it was pitch black out and you're going to the bathroom in the middle of the night? You put your hands up. That's a way to protect the face and the surrounding area. So that's that tendency to put your hands up. But you really don't have engagement of the feet. You're not having that kind of thing. And I'm really suspecting at the same time genetics. Meanwhile, that's medical. So you have to go to the ophthalmologist, and please, you have to go to genetics. Now, in some states, countries, insurances, you have to go to neurology first and then to genetics. I think this would definitely be a genetics call. Genetics, you might have that person sort of like me that walks in. Hi, Casey. Casey's one of them where she was worried for her daughter, thinking it was something on, and I was like, no, it's genetics. But it's very, for genetics, and I've got a munchkin in now, to put the feet down, and people think that's a sensory thing. But it's the engagement of where gravity is. When the DNA is spinning at a different rate, right? It just throws the movements. What you're seeing is not spasticity. I almost want to say it's a sloshiness. So in other words, like if I have my coffee, you know what I mean, and I'm moving, right? That sloshiness, but you're seeing it all the way out into the extremities, that sloshiness. You really see it in something like NCAGE, which is not what your child has, but it's just that there's certain types of genetics that create that. But I'm concerned too that the visual engagement is not there as well. So we can start, I'll post a video about low-level vision and how to start engaging and what to be done there. Watch your auditory. Now, you might have to use noise at first to get the engagement for vision and then back it off. But you can see this too, if the vision's not there, then the ears are here. This is what my son had to do because he was legally blind for about 3 years with his infection in his head. And so he would get this because the eyes weren't working. But again, the ears are here and so are the eyes. So it throws you off thinking that, oh, you know, my child doesn't miss a trick. They have directionality. That doesn't mean they're seeing. They're not engaging with that. And then two, that backbone. Again, you know, y'all can feel it right now. I'm saying y'all because Casey's watching. So your mama would be proud of me, girl. And so when the vision crosses a visual midline, right? So I go from here to here. My vertebrae, it's almost, and this is where people are just so confusing with the fascia. The fascia works as a connection. You can't do one section and not the other, especially if vision's off. So when I have visual engagements, right? My vertebrae, right? In each one, You know, the spinal column is not here. It's each one engages like that, and you will get that. You won't have that when you don't have that kind of vision. Then you get again that lack of backbone, and especially too if the feet are up. Guys, put your feet down and try and write, right? And now put your feet up and try and write. There's just no way. You just don't have the structure needed for movement. So with that, milestone-wise, I really want you to go down and do the breathing course, because the breathing, just catching the full breath. I know he breathes okay, but catching that full breath, if the breath, you know, that kind of thing, and you don't have that breath swallow ratio just as nice as it should be. I go to make a movement, you know, and kind of thing, and you're just not getting that. I want you to start right out there with breathing, and then honestly, you're going to start going through them. I want you to go through tummy time rolling over, because the process of movement is not happening. And the process of movement doesn't happen because the DNA replication is just off. I hate to say this simply, but imagine I have a top and I'm spinning it, and now I put a little piece of tape on it. That top will not perform just from that little bit of tape. That's what genetic DNA does to movement. Progression is still can be there, but you've got to settle down the movement inside the body for the movement for the outside the body to happen. In this case, it is a bit more advanced, but you can do it. I don't treat you like you can't, because I had one of the most complex kiddos out there. And so I'm like, now I'm at the point, well, if my son can do it, then everybody else can do it. But really, you need help, and you need engagement. You've got a kiddo that's got good eye contact, directionality, and the cute eyes, and you're just not getting the help you need. They're waiting for him to fail a bit too much. But honestly, you need to start pulling those panels and look at that. But a geneticist is going to, hopefully you have the person that walks into the room and is like, oh yeah, I see what you have. I know what you have, but I don't know what you have, right? So I know you're in genetic realm, but what exactly it is. But like I have a kiddo in today, we don't know what it is. I know what it is because I'm working with this. You know, a lot of genetics have these looks that are the same. And actually, when he came in, I'm like, wrong parents, right kid? You know, kind of thing. The familiarities are just so similar. And so I actually just sent an email out to the mom saying, what did your son have? Because I got a kiddo that has it. And so that's how genetics kind of works, almost like you're playing chess. And that's the type of person you want to go to, but you want to get in that queue, because sometimes, guys, these guys are booked out like months. You know, I would do a stat order. They might not stat it. The reason they don't, if there's no health complications that you're having, they're like, yeah, well, when it happens, it'll happen kind of thing, but your child's not at risk, because they're looking at it medically. You're now looking at it developmentally, and that's where the conversations have to improve within our realm of movement and medical. Thanks. Hi, Casey.